Now it is time. So good morning, good afternoon, and good evening. I'm Dr. Beatris Gesner from the Philippines, welcoming you all to the uninterrupted daily Zoom meeting of International Forum for Promoting Homeopathy. Before we proceed, I would like to have 1 minute silent prayer for the success of the vision and mission of IFPH, and also for the successful conveyance and beneficial assimilation of today's Zoom session. Let us have 1 minute silent prayer. Today we are having the 348th Zoom session of International Forum for Promoting Homeopathy. For the information of those who joined for us for the first time, IFPH is an organization formed by a group of homeopathy lovers, doctors, and students at the time of pandemic for the conveyance of the message that homeopathy is the best preventive treatment and rehabilitative solution for the pandemic. At a time when the world remained panic and remained unaware about the management possibilities. And even today, the world remains in panic. There are so many hidden agendas, but all these can be properly curtailed by the homeopathic system of medicine. Even the side effects can be managed by homeopathic system of medicine by influencing the higher levels of our existence. So today we have a very wonderful person from the birthplace of homeopathy, Germany, who is none other than Dr.Beatris Gesner, who is a medical doctor and with the 35 years of experience, specialized in dermatology, pediatrics, and general medicine. Dr. Gesner is practicing homeopathy since 30 years. She worked in the only hospital in Germany specialized on homeopathic treatment for severe conditions like allergy, asthma, and neurodermatitis from 1991 to 1993. Currently, she is working in her own private clinic since 27 years. She is teaching regularly in the courses of Central Homeopathic Organization in Germany, DIAGNOSE, and giving seminars in Portugal since 8 years. Today, Dr. Gesner will be talking and continuing her presentation as the second part regarding homeopathy and skin disorders. She is a dermatologist and specialized in skin disorders management. Over to you, Dr. Gesner. The floor is yours. You can proceed.
Thank you very much, Dr. Shadi, for the warm-hearted welcome. And I also would like to appreciate very much the work IFPH is doing, and also giving us the possibility to exchange our homeopathic knowledge on an international level. So in the meantime, every day you provide us with a very interesting presentation in different fields of medicine, homeopathic treatment, and so on. And I would like to say that I appreciate this very much, and it's very interesting for our colleagues, for me also, myself. And today I have the pleasure to continue with you with dermatology. So perhaps we could, you could share the screen.
Yeah, please.
Yes.
Proceed.
Yes. Okay, is it visible?
Yes.
Yes, okay, fine. So today I would like to investigate with you a very interesting question. Is it possible with skin disorders, just by the picture of the skin which is given to us, which you can see, to conclude what remedy we could choose. And of course, there are always special indications, like if we have pustules which are itching. Of course, we are thinking, for instance, of Rhus toxicodendron. Or if we have pustules who have a kind of inflammation of pus, we are thinking of Silicea. Or if we have a dry skin eruption, which can be scaly, white, we are thinking of Arsenicum album or Natrium muriaticum. But until now, in my experience, there's only one remedy, or for me, one important remedy, which can really show this is expression and give us a hint to choose this remedy. And this is a very special remedy, which is very useful for skin eruption, which are moist, wet, with a discharge. Very often it's more around the head, around the scalp. At the same time, this remedy is affecting or helping very much with disorders of the bones, problems of the bones, and problems of the nerves. And it's a fantastic remedy after influence of vaccinations. So perhaps you already know what I'm going to talk about. So let's see here, case 1. Okay, it's a girl, 13 years old. I will show different cases of acute and chronic disorders of this remedy, and also a bit complex cases, which will take, or did take, months or even a year to be treated. So we start with an easy case, which is a nice girl, 30 years old. And she is a friend of us, and she came with this kind of skin eruptions. If I put it on the other mode, you will see it more easily. So what we can see, we see that discharge, that big spot here, but we also see these little pimples at the forehead, at the nose, and also at the side of the face. So that kind of eruption developed within 2 days. So what happened to that friend? As a girl in that age, she had some pimples on the face, and she was taking hot water, the foam of hot water, and picking all these pimples. And her hand apparently have not been said that had been not that clean. So she got this eruption. This is a infection, bacterial infection of the skin. It's called impetigo contagiosa, and it's contagious. If you touch your skin and you touch another person, he also can develop that kind of skin disorder. Normally in dermatology, we have to give an antibiotic, or we have to, and at the same time, we have to infect the skin. So she got Mezareum, C30, 1 dose, and every day also diluted twice. Next day, the skin seems a bit calmer, no new eruption. That's very important. It's always a question, what can we expect? Will we expect that the eruption will disappear within 2 hours, or do we expect it will be better within 2, 3, 4 days? So we have to be very clear on that. That kind of infection of the skin in the face, we are happy to see the next day it's not getting worse. Okay, so we see the face, it's a bit more calm. Okay, therapy, we go on with the Reum C30 diluted twice a day. 7 days later, the skin is much better, and we have a beautiful girl again. So that's a very common remedy for impetigo contagiosa. And I don't know how it is in India, whether you have a lot of cases or similar cases with that kind of moist discharge in the face. Here in Germany, it's more with little children normally. It starts if they have a coryza with a discharge, and they scratch here, they scratch here, they scratch here, they can develop that kind of infection. And mesothelioma is one of the most important remedies to help us to treat that kind of skin disorder. Now I have a case of a 10-month-old boy. Case history with 4 months vaccination with DT polio, diphtheria, tetanus polio, and HIV. Short time later, he developed an eczema at the left arm where he had been vaccinated. So here's a little boy. What we see here, it's not a normal eczema. If I see many children in that age coming with an eczema, very often they can have it at the face, or they have very often at the bands of the arms, bands of the legs, also on the décolleté. But that kind is a bit strange. And what we see, it's not like, how we say, it's in spots. It's not like is covering bigger parts of the body like the eczema normally does. So this was a bit strange for me, and I had difficulty to solve this case. Here we see the boy a bit closer. Okay. Eczema with red spots at the arms, face, and also band of knees, and that special spots on the arms. Now, if we want to treat an eczema with little children who don't talk, it's not that easy. And very often they don't have so many symptoms. So normally we have to go in the way of to look for the constitutional remedy and to see what is the disposition of the child, the behavior, the likes, the dislikes, as we know. So this child is very friendly and likes a lot of attention and likes a lot of skin contact, and was not afraid when I was investigating and observing everything. So I decided to give him phosphorus. First phosphorus C30, later phosphorus 200. And the effect was more or less. And this we do have often in our practice. It's more or less ups and down. After 2 months of treatment, not really better. And if we treat with C30, C200, we have to wait. So it takes more time. So I decided, because of the vaccination, to give Tuya. And there was a little aggravation for 3 days. And then he was better for 3 weeks, and we were happy. But got worse again. So I decided to give tuberculinum, the nosode. And because also this, the situation was changing so much, I felt tuberculinum as nosode was indicated. And it was much better the first days, but got worse again. Ta. Then he developed thin stools. I thought to myself, perhaps sulfur could be a good idea to clear the reaction. And at that time, the mother was really in despair. And sulfur did not help. So we are now 7 months after the beginning of the treatment. Ups and down, not really better. So I said to myself, there must be a blockage. Why this child is not reacting normally to well-indicated homeopathic remedies. So I went back to the laboratory. Skin eruptions after vaccination. Metzreum, Sarsaparilla, Silicea, Duya. Okay. And the itching was very strong at night. And I was looking for the diarrhea also. Just a second. So if we take the symptoms, we see Metzreum, Sulfur, Silicea, Medurinum, Midaz, Mercurius. Okay. And I decided to give Metzreum C30. 3 weeks later, much better, less itching, less diarrhea, okay. 5 weeks later, very good. 8 weeks after a single dose of Metzreum C30. So the child is very well. Quasi no eruption anymore. Okay, life goes on. The mother says, no, he needs the next vaccination because he just got one. So I said to her, okay, if he is in a good state, and he is in a good state, he can be vaccinated. And that is also my experience in my practice. If the children or the adults are in good state, that there's not a very big fear of a severe aggravation of the vaccination. So the child got vaccinated. 3 weeks later, the skin is starting again. So also very interesting, not 1 day later, not 1 week later, 3 weeks later, skin is starting again. What does it mean also for today with our corona vaccinations? The symptoms which are occurring after the vaccination within 1 month or 6 weeks can be connected to the vaccination. We know that, but our allopathic colleagues, if the first week is over, for them it's clear, everything what's happening afterwards, no problem, no connection with vaccination. But in homeopathy, we can see that these are proofs. So the skin is starting again. What shall we do? No fear. Right. Another dose of Metzreum C30. And 7 weeks later, mother was phoning me. Skin is already very well. He's fine, no problem at all. And later he had to take other vaccinations and he did not have any problem. Yeah, is a boy. Okay, so to keep in mind, Metzreum to be a very good remedy for vaccinations. Conclusion. Sometimes we need time. Last time I was talking about the skin diseases, I got a very nice message from a colleague from Pakistan asking me, Doctor, how is it possible you had to choose 2 or 3 remedies? We have to find the remedy in the first place. We have to find the remedy, the first remedy we give, it should be the minimum. How is it possible you had to take 2, 3, 4 remedies? But this is our normal life in practice. The vaccination can be a blockage, and there are more remedies than too young. And what was interesting here, after the right remedy, the recuperation of the skin is quick and with less waves. Before it was more or less, more or less, more or less. But after Metzreum, it was clear, better and no waves. And very interesting here also, at the point of inoculation of the vaccine, there were the first eruptions. Okay. Another case, a little boy was sent by my colleague, pediatrician colleague, very much affected with a super infection of the skin after vaccination. So we can see all these spots on the back also. So case history, 7 weeks ago, vaccination with DTP, HIV, and pertussis. 1 day later, strong biting behavior. The mother said it was very, very strong. He was biting into the mama. So there, there has been a certain affection of the brain. The child did start biting. So 1 week later, first eruption, which later became became worse and moist. He went to hospital because it was so strong, got antibiotics intravenous, went back home, another aggravation. And they went to my colleague, and she was in the beginning of her homeopathic pediatrician practice. And she gave 2-year D6 and later sulfur D6 3 times daily with a strong aggravation. And you saw the pictures. So what shall we do? What was very interesting, the mother told me, there's something very special. My son, he has very cold hands and feet. I dress him, but he's so cold in hands and feet. Okay, family history. The mother has an allergic predisposition, asthma, bronchial pollinosis. And interesting enough, during the pregnancy with this child, the skin eruption, the mother had skin eruptions all over the body. So that information came by the little one, by the baby. Mm-hmm. And the father of the child also is suffering from asthma bronchiale. So I went to the laboratory, skin eruptions after vaccination, hands icy cold, and also urticaria, because before he went to the hospital, he developed an urticaria. So we see remedies like Metzerium, Silicea, Sulfur, Thuja, Arsenicum, Hepasulfuris, good remedies. I choose Metzerium, D12 3 times daily. 10 days later, the skin is improving. We don't expect 2 days later, everything is gone. But if the next day it's not worse, the next day, perhaps a bit more calm, the next day, a bit less red, then we are happy. So the skin was improving and the hands became warmer. 5 weeks later, the eruptions are gone. Here's another picture of a woman. She's coming every winter time. And she has that white dandruff in the hair, strong dandruff. And she's getting, every winter, she's getting once, Metzerium 200. And she's doing fine with this. And now I have a special and really complicated case for you. But as you are specialists in homeopathy, it will be interesting for you. So we have that child, 2 years old, more or less, 1.5 years old. And the case history was a bit tragic, because the child was playing on the floor. The mother was preparing hot water for a tea, taking the pan with the tea and was falling, and all the hot water on the head of the child, the arm of the child, a big, strong burn. The child was hospitalized and developed a lot of crusts and was developing fever also, and got antibiotics in the hospital. And 2 months later, it still was very strong on the head, no fever, lot of discharge, and the hospital wanted to operate a second time, to remove everything as a second time. So here. So the parents came to see me, and we started with the treatment. So I started with Metzerium, LM1 or Q1, 10 drops daily, to see whether in short time there will be an improvement. And next day, the discharge was better. And 3 days later, it was getting more dry. So we were happy, and so it was the right way. So go on with the remedy. 1 week later, again, more discharge. So if after 1 week of treatment with LM potencies, first it's getting better, then it's getting more difficult again, we have to make a break to stop the remedy. Okay, we stopped the remedy. 1 week later, it was a bit better, worse again, I decided to give C30, Mezereum. 1 week later, it was more or less the same, but now the child is developing fever, and that is not a nice sign. So I had to change my path of treatment. It was urgent now, because if the child would could get an inflammation in the body by these eruptions on the head, that could be dangerous. So I looked for the constitutional remedy, because Mezereum was more local for treatment, and now we have to treat the constitution also to help to overcome the fever and the beginning infection. So the child had more discharge, was starting to get pustules on the body, hands and neck more sweating. It's a lean child, a lean person. And she was is a bit special. She picks up very little pieces. She has a very good memory for details. So on the psychological level, I decided to give Silicea, C30 twice a day, C30 twice a day, not for the skin eruption, but for the beginning fever. Okay. 3 days later, fever is better. More blood below the crusts. What does that mean? Developing more blood below the crusts. For me, it meant that the process of healing is getting more active. Less discharge of pus and more blood. So, and they went to the hospital for the routine, and they said, oh, we have to operate a second time. And the parents said, no. So we stayed with the remedy, gave Silicea 200. We are more or less 3 months after beginning of treatment now. It's the time is passing. 10 days later, general health is good, no fever, crusts are more dry, less discharge. We are happy. 3 weeks later, 4 weeks after Silicea, a form of stagnation that is normal after 200. After 3-4 weeks, there can be the need of another potency. So what do? Do we change the remedy? We have the stagnation, we change the remedy, could be a better remedy for this child. No, please, if you treat skin diseases, be careful to change too much the remedies. So we had a good way with Silicea for some weeks. So I decided to give the higher potency, C1000. Yes. 2 weeks later, much better, less crusts. We are happy. So we can see some pictures here. That's the grandmother. So you see it's getting better. Better. 5 months later, control in the hospital. Now they want to remove the last crust, and the case is more or less the same, not developing a lot. So we see the last crust on the right side. They want to operate. The parent said no. Okay. So what shall we do now? We started with Mezereum. The case became a constitutional case, developing fever, different symptoms. Now, after months of treatment with Silicea, it seems that the remedy has done its work, and we should try or should go the next step. But which step? If we do the wrong thing, we can spoil the case. She can become worse again. So here I decided, okay, we are at the end now. It's only a local problem at this moment. So what did I do? localized disorder, localized remedy. I decided to give once again Misereo in a high potency. With good result, I can tell you. We were happy. 2 months later, there was a short and strong discharge, and now it's much better. This is my practice in Constance, where I'm working. Now it's much better. Sister, everything clear. But the hair will not grow again because the destruction was too strong. Now you see her as an adult, beautiful lady, no problem with her hair because she has enough hair to cover that part of the head. And she also has children, and we have, from time to time, we have contact. Okay. Conclusion. This one-sided disease, a local remedy in the beginning. Then we used the constitutional remedy, and at the end, the local remedy again. And Silicea also is very well known for strong pustules in discharging skin affection. As last time we had that little child with that pustules on the legs, also was a Silicea case. Conclusion, nearly 1 year of treatment. If we treat skin conditions, chronic skin conditions, we have to tell the parents before that we need a lot of time, that they can get, that they have an idea of how we are going to treat. But within short time, we should see whether the remedy is working or not. Not waiting for 1 year, no. But the up and downs are very normal in skin disorders, especially in atopic eczema, especially there. We need patience and stability. Don't change too often the remedies. So if we talk about Mezereum, it's such a nice remedy. We have skin disorders. It's acting on the membranes, on the bones, on the nerves. And the action is violent, it's strong. Has a strong aggravation at night. For these reasons, it's called the herbal mercury. And here also we can, it's very special. We have a remedy, which is called Mezereum. It's good for skin affections. At the same time for bones, at the same time for nerves. And allopathic remedy, allopathic medicine, we don't have these things. So here we also see again that our remedies are working on an energetic level and can help. The same remedy, as we all know as homeopathic doctors, can help in the different fields of the organism. And this is very, very nice. Skin eruptions, they have a violent itching, are worse at night, worse warm. Many of them are yellow and discharging and moist, and also can develop, the yellow can develop, go into brown crusts on the head. And also we have that problem of skin eruption alternating with asthma. So if we have these people, we have to be very careful not to, that the skin will be better and we suppress, and they will have breathing problems. So from now on, we will have in mind that Mezereum is a very good remedy affecting the scalp with crusts. Discharge is a very good remedy for affection after vaccination. Also neuralgic pains of the teeth, post-zoster neuralgia. At the moment, these corona vaccinations, one very, very common complication is that people develop herpes zoster in the face or other parts. They develop strong neurological pains in the face. And I was talking with a friend who was who needed help in the hospital for dermatology because she had severe skin problems, and she was talking to the chief doctor, and he said, it's strange at the moment, I see so many herpes zoster affections in older people in the face after vaccination. So to keep in mind, if we see these patients, let us think about Mesoreum. Yes? Okay. Do I still have time to show one case, or?
Yes, madam.
Yes, okay, fine.
Yes, yes.
So a woman of 52 years under treatment for chronic eczema in my office. Since many years, mostly she got Arsenicum album. And she came with very quick eruption of pustules in the face 2 days ago, swelling of lymph nodes, no fever, but not feeling well. These skin eruptions developing within 2 days. So if we look close, we can see these little pustules getting yellow. But this, I tell you, is not a Mesoreum case. No, why not? What we see here is a herpes infection, a herpes, strong herpes, that can be dangerous and a bit strange. You can see it in the face, around the mouth, and also here at the side of the neck. And she said it came all of a sudden and very strong. Can we do something? So I said, well, honestly, with that kind of skin eruption, that can be systemic herpes. So perhaps I think I will have to send you to the hospital to get medication intravenous, because this can be dangerous. And but we can try today. So here you see at the side of the face. So what could I do? Here we have a very sudden and strong affection of this woman. So we need a remedy with a strong, sudden, and dangerous. And I decided to give mercury. Mercury, 200 and twice a day diluted. And I said to her, if tomorrow you're not better, we have to send you to the hospital, because it also can affect the brain, that kind of systemic herpetic eruptions. Next day, sleep was quite well, no more pustules, and it seems that the region around the mouth is less swollen and no fever. The lymph nodes can be swollen. That is not a problem, because they are helping the body to take the toxins. The lymph nodes are not the problem, but more fever, more pustules, I would not have continued with my treatment. So 1 day later, after 2 days, it's impressive how quick the skin is getting better. I'm sure with the antiviral medication, it could not have been more quick. Much better. You see the face is less swollen. The pustules are less aggressive. So we went on with the therapy. Next day, even better. Once a day. So I went down with the dosage from twice a day to once a day. Okay, and she was fine, did not have to go to the hospital. Now a last and short case. Very often in the practice, we have acute allergic reactions. It can happen, you eat something, you develop a eruption within a few minutes, mostly around the mouth, in the face. Also, it can be possible the hands are swollen, the feet are swollen. Okay, acute reactions. We have that woman. Very swollen face around the eyes. Do you recognize this woman? It's the same. It's the same woman. We have our patients don't leave after healing and never come back. So because she had an allergic disposition, years later she got that kind of skin swelling. This is not very difficult. If you see this, the remedy is very clear. We have to give APIS. Okay, you know that APIS 200. And dilute it every 4 hours. Not only one potency and wait 6 weeks, no, more and more in the first day. That's my experience. 200 pure and then diluted 4 times. Okay. 2 days later, she was happy, everything was fine, and she was smiling. So we have many blessings with homeopathy. And thank you for your attendance. And I hope this could be a help for your practice. And especially with Metzreum, we don't miss Metzreum anymore. We don't always think about Tuya after vaccinations. Keep in mind, Metzreum could be a good option. And once again, I feel very happy that IFPH is promoting this kind of information to the whole community. Okay, thank you very much. And I am open if there are any questions.
Thank you, friends, for your continued listening. And if anybody have any questions, please go to the participant list and raise your hand so that we can entertain your questions. So the first one to raise hand is Rose. Rose, you can unmute yourself. Please introduce yourself also and ask your question.
Hey, hello. Can you hear me?
Yeah.
All right. Okay. Hey, I'm John. Yeah, sorry, I was using my kid's profile. Hey, I'm from US. I'm not a doctor as such, but I'm a homeopathy follower. I have a situation which I can show you the video if that helps, or I can explain it if that helps. Whichever you think, whatever you think, I can do that.
Ah, now we see you. That's better.
Yes. Oh, hey, ma'am.
Hi. Hi.
Okay, so let me show you. Let me get into it. I know that many of the yeah. So this is my case. It's, I don't know how. Is it good now?
Yeah, visible.
It's on the back of the feet, huh?
Yeah, right. Is it good now?
Yeah, you can see. Yeah.
Okay. So the case is, it's happening every maybe 2 or 3 years frequency. It's not coming on every year, but it's happening maybe every other year or every 2 years. And it's happening for some time. And I tried long back when I was, the first time I noticed when I was, I think it's 18 or 19 years old. Then it came back maybe 3 years later. Then it came back around when I was 36 years or so. Now, after 36 years, it's happening maybe every 2 years or 3 years. So this is the 4th or 5th time I recall. This is happening on the same leg, same place, same food, almost the same place. And long back, when I was in India, I was using Ayurvedic medicines. Pretty much, it used to work out with applying a couple of weeks. But later I moved to US. It seems like, it's quite difficult to get Ayurvedic medicines. Then I was trying to get homeopathic this time. Of course, once I tried with some allopathy modern medicine creams, it's basically, what is that cream?
Let's have a question now. If you have that skin condition on your foot, how long does it normally stay? You say it comes again, another year again. How long? Just to have an idea.
Once it's come, it used to be there at least 1 to 2 weeks. I mean, sorry, 1 to 2 months or more than that.
Yeah,
unless I applied unless I applied any medication. Yeah.
Yeah. And do you have any itching?
Yes, it used to be, but it's like once in a day. Once I itched per day, or maybe once in a day, then we won't feel, or I won't feel that itching again.
Okay.
It's comparatively less, not always. Yeah.
It seems that it's has a brownish color. It seems on the picture now. Is that right?
Yeah.
Brownish
It's
gray
like,
color.
Yeah. The skin tone is like, it's a quite dark brownish color. Yes.
A bit strange. It doesn't seem to be an inflammation.
Yeah, there is no inflammation. That's correct. Yeah.
Unless
I itch quite heavily. Yeah, that's correct.
Okay. And okay. And it seems also a bit more thick, the skin. Is that right?
Yeah, it's slightly thick, and it used to start like maybe a quarter of a penny size, US penny size, and it's slightly grows at the edges, and it reaches at this stage. I tried with the sulfur and with the other one. What is that? The Mercurius solubilis. Yeah.
Yeah, Mercury. Okay, so just to keep in time, because there are more questions. Of course, you could contact me personally, no problem. If I see the picture, I could think about petroleum. You also have cracks there.
Yeah, cracks used to develop, but now there is no cracks. Yeah.
Okay.
I mean, there could be. You can call. I mean, I don't know how closely you can watch it on the video.
Yeah, we can see it very well now. And on the other hand, there seems to be a constitutional situation that your body is developing always at the same point of the body, that kind of skin eruption. Normally, we say if the body only is developing skin eruptions, it's a healthy sign of the body, So, be careful to suppress. Okay.
Yeah.
So only if you are suffering, we could do something soft. Just to have that idea. Okay. So at the moment, I would advise as a first step to take petroleum, because it looks like a bit oily petroleum. In a low potency, twice a day. Do that for 2 weeks and contact me again. Okay.
Better you contact Dr. Beatris directly and get a prescription. Are you familiar with the homeopathic medicine petroleum, or you can?
I can do that. I can work with one of my cousin. Really appreciate. Yeah.
Okay.
Yeah.
Yes.
Okay.
Dr. Shadi, you can give my contact to him. No problem.
Yeah.
Okay. Thank you.
Yeah. Really appreciate. Thank you.
Okay.
Now I invite Dr. Subaida. Dr. Subaida, please unmute yourself and ask your question. Dr. Subaida, please. Please unmute from your side, Dr. Subaida.
Hello.
Okay.
Can you hear me?
Yes, we can hear you. Yes.
Okay, madam, it's a very nice presentation. I just want to ask you regarding the mesothelium. Have you seen getting an action immediately? I heard that mesothelium will take time to get the result, because you have got many experiences with the mesothelium.
Yes.
How long?
Can you show yourself? It's nice if we can see your face. So it's a good question with mesothelium, because if it's that kind of skin eruptions with that crust, it will take time. That's right. If it is a reaction, post-hysteric reaction with pain in the face, it also will take time, but not too much. Now I see you better.
Okay, okay. It's okay.
From which country you are talking?
She is
I'm now
from
in
India.
Qatar.
From
No,
India.
I'm
Okay.
Dr. Subeda from Kerala. She is a professor in a homeopathic medical college.
Okay. So
today
you
I'm in
had,
Qatar
yeah, I would,
She's Qatar now. Okay.
in a
okay,
hotel
thank you.
quarantine.
But like with a post-hysteric pain, I would expect, if you have a good potency, here with a nerval affection, I would give 200, C200. I would expect the next day a bit better, not waiting for days and days and days. But with the skin eruption, we have to, because the body cannot be quicker than biology is possible. But if we see less discharge, less itching, it will be the right way. Okay?
Okay. And my second question, I have noticed you're repeating Merxol Willis twice daily like this. Merxol, Mercuriasol Willis.
Yeah. Mercurius solubilis.
You are repeating.
Yeah. You know why? Because the situation was dangerous.
So there was no aggravation by repeating.
No, because
like this
the
every
body
day?
did need something very strong. Just imagine, this was not an infection outside of the skin like impetigo contagiosa. It was coming from inside. You were seeing within 2 days all these eruptions coming out. So the process was inside. It was a strong viral infection. And we learn with strong diseases or acute infection, we have to give more. It was kind of not intuition, but for me, it was clear. If it's not getting better within 1 day, I have to send her to the hospital. Okay?
Okay.
We did not have any aggravation.
Have your contact number, madam, and have a personal contact. Okay, Dr. Shaji, can you please?
Yes,
Okay.
yes.
Yes.
Yes,
Please
Okay.
thank you,
No
doctor.
problem.
Thank you. Thank you.
Thank you.
Next is Dr. Logmani Gupta. Dr. Logmani, please unmute yourself and ask.
Thank you, sir. Timely good wishes to all. Very nice presentation regarding miracles of Magerium. One thing I would like to thank Dr. Beatrix ma'am. I had started Arnica 1M to my ma'am, which she told in last session. I'm grateful to her. Secondly, I would like to ask about 2 medicines. You had prescribed Magerium in case of scabs, chill tendency, and that all, the Magerium. Ma'am, kindly differentiate Hipper sulf and Calcarea sulf also, which are most commonly used in such situation, please.
So do I understand the question right? You want to have Hepa sulfuris and Calcarea sulfurica.
Yeah, ma'am.
With eczema or with kind of skin eruption?
Ma'am, in head, the children case was there, where scabs on the head. Yeah.
Okay, yes. Yeah, very good question. Yes, could have been a possibility. Hepa sulfuris, because it was oozing, yes. But this Hepa sulfuris, I see more, I don't see that strong crusts on the head, on the scalp. And Dr. Lukmani, Mezereum has a certain tendency to affect or help the affection of the scalp. So it's the first remedy. But of course, you could have tried with Hepa sulfuris or Calcarea sulfurica. Especially Calcarea sulfurica is a very, very good skin remedy also for eczema for the little children. Mm-hmm.
Thank you, ma'am. So nice of you. Thank you.
Yes, okay.
Thank you. Now it is Dr. Manoj. Dr. Manoj.
Thank you, Dr. Shaji. Very nice presentation, Dr. Beatris. You are a very special guest for us because you are always participating in our discussions as well as the progress regularly. It's nice to see. Then I think the the medicines miserium is often a good indication for this neuralgias and as well as the after vaccinations. And
Yeah.
what we are seeing in now India, I think all types of reactions you can expect when a person is taking the COVID vaccines. This is my observation. I think if there is some disease in the family history, or some definitely that condition, if it was latent there, that will be activated by this vaccination. Then another thing is that when we are treating a patient with some symptoms, that symptoms are got aggravated. Then again, the old symptoms are reappearing. Plus, new diseases are producing, new symptoms are producing. So it complicates our cases. What we are seeing. So what is the result is that the homeopathy will get more edge on that. Definitely the patients will suffer, but we are capable of combating all these situations. That is very important thing, I think. So we must thank for vaccination, I think. Very nice presentation, madam. Then another thing is repetition acute cases is nobody is objecting. We can repeat according to situations. Homeopathy is always conditional. Health is a condition, disease is a condition, and recovery is a condition. Conditional. That is why Hahnemann always remembers this as a condition. That means it is changeable. So there is nothing wrong in repeating the medicine. Then again, the potency we can go up to higher or lower. Then I think you don't mention about the diet and regimen restrictions in this case. That is also an important factor in containing the skin diseases, I think. Thank you, madam.
Thank you, Dr. Manoj. Thank you.
Thank you. Then now it is Seyda Yarkin from Turkey. Please unmute yourself.
Okay, hello. It was very nice, your presentation. I have a question. If the aggravation is very, very severe, do you do any kind of antidoting? I always wonder about that. Or we just wait on the skin eruptions and treatment?
Okay, yes, that's a very good question. You don't wait. If the aggravation is so strong, just don't wait, but help. So there's a possibility to give comfort like ointment or drink coffee, but aggravations of the skin affection, I was talking last time, you can avoid if you don't give high potencies. If you have allergic eczema, please don't give 30 or 200 and wait for the aggravation. Start with LM potencies and you don't see a lot of aggravation, very little only. Yes? And another answer, if there are other conditions, you give a homeopathic remedy, there's an aggravation. You have two possibilities. First, to give camphor or to stop the reaction, or to give the better remedy you have in mind. That is also a possibility, okay? But not with skin diseases. Here, you can mix up everything.
Yeah, I know. Thank you. I remember your first presentation and your soft potencies. I prefer that. So
Yeah.
if it happens, I was wondering what we could do. Thank you so much.
Okay, it's a pleasure.
Okay, next is Dr. Bob Lim from Malaysia. Bob Lim, yeah.
Yes, here he is.
Yes. Guten Tag, Dr.
Guten Tag.
Wie geht's?
Danke, sehr gut. Grüße nach Malaysia. Meetings to Malaysia. Grüße nach Malaysia. Okay.
We have only 1 more minute remaining. Please ask a short question.
The Mediterranean, the one with the scarf you started with Mediterranean, then you go to Cilicia, then you go back to Mediterranean again.
Yeah.
So Cilicia at that stage, I didn't catch you. Why you have to change back to from Cilicia?
I understand. For me, it also was a surprise. But first, it was a located remedy, Metzerium. Later, we started with a constitutional treatment. And at the end, there was a little rest here, And Metzerium again finished the case. The local affection.
Oh.
It was like it was. Okay.
Oh, you in the midway you give the constitutional
Yeah,
remedy.
yeah. For months, for many months in high potencies, everything. And the little rest at the end, I did not have another idea. I said, it looks like Nitzurium, try it again because it was helpful in the beginning. Okay?
Yeah. Thank you. Danke.
Okay.
Danke gut.
Okay,
Greetings to
thank you.
Malaysia. Yeah.
Thank you very much. So it is our time is 1 minute over our regular time. So it is time to pass over to the next session. We have tomorrow our last session of our fundraising program of Dr. Ismail Said, our president, who will be having our last session tomorrow. Those who wish to participate in his special fundraising webinars, please, we appreciate you joining our webinars, and tomorrow is the last session of Dr. Ismail Said. So with this, we wind up. We thank you, Dr. Beatris Gesner from Germany, on behalf of International Forum for Promoting Homeopathy, for continuously enlightening us and representing and having your presence and interaction with us, and all those who participated from different parts of the world. We thank you, and handing over the session to the next moderator for the Malayalam presentation. Thank you, Dr. Gesner.
Okay,
Thank you all the participants. See you again tomorrow.
See you.
Over to the moderator.
Next, doctor.
Yeah.
നമസ്കാരം. ഇന്ന് നമ്മുടെ മലയാള സെഷൻ്റെയും അതുപോലെ തന്നെ ഇംഗ്ലീഷ് സെഷൻ്റെയും 348ാമത് വെബിനാർ ദിനമാണ്. അപ്പോൾ ഈ ദിനം തുടങ്ങുന്നതിന് മുമ്പായി നമുക്കൊരു ഈശ്വര പ്രാർത്ഥന 1 മിനിറ്റ് നേടി. നമ്മുടെ ഗസ്റ്റുകൾ ജോയിൻ ചെയ്യുന്നതേ ഉള്ളൂ. അപ്പോൾ ഒരു 5 മിനിറ്റ് ഒന്ന് വെയിറ്റ് ചെയ്യാം. അത് കഴിഞ്ഞിട്ട് പ്രാരംഭ നടപടിയിലോട്ട് പോകാം. അതുവരെ നമുക്ക് തൽക്കാലം നമ്മുടെ
we can continue our English session. So anybody from different parts of the world wish to communicate anything to us, you can do it now. Those who are present from other countries, if you wish to have any communication to make with us regarding any matters, you can raise your hand, and we can spend these few minutes. Our guest for Malayalam session is yet to arrive, so we can use this time for communication with IFPH. If you have anything to communicate with IFPH, this is the time for that. Please raise your hand so that you will be unmuted, so that we will be able to communicate each other. Anybody from any country wish to say something, wish to make any communication with IFPH, please raise.
I think it is better to discuss about the vaccination by vaccination and homeopathic vaccination. That's about arsenic. I'll be able to say something about what is the latest development happening around the world, and particularly in India, whether we got any order to do the same or not. I think Dr. Shaji can explain these things in a.
There are pending cases in the court, and so the court is postponed the case on August 24. This is a vacation time for Onam celebration, and after the Onam celebrations, that court will reopen on 23rd or 24th. So the cases are scheduled for hearing on 24th, as I understand. And as per the understanding in Philippines, the Senate of the Philippines is giving an indication that vaccine may not be mandatory here.
Good.
Yeah, that is one thing. And in India also, officially it is not mandatory, but certain governments in states are trying to make it mandatory, or some people are giving propaganda and forcefully implementing in certain departments or government sectors forcing innocent people to forcefully vaccinate, and that is a danger because vaccines are, we are not, IFPH is not against vaccination, but COVID vaccination is an unproved thing to be to make it mandatory, and it is not yet fully proven. And homeopathic preventive medicines are very effective. Arsenic album is a very effective medicine. Not only that, it is it can do prevention against all variants of viruses. That is another advantage. Vaccines are more of specific for specific variants. So we need to, if you plan to depend upon vaccination, we need to repeatedly take the vaccine, and each vaccine has a lot of side effects. All these are there. And today there is an important post from South Africa. The surgeon declared that the risk of vaccination is worse than the risk of virus. And the vaccination was not brought for COVID, but COVID infection was brought for vaccination. I think it is a very relevant statement. It was Dr. Susan Oslu, a heart surgeon from South Africa. Her video is getting viral in YouTube. I will repeat the sentence. The risk of vaccination is worse than the risk of virus. Please take note of this. The risk of vaccination is worse than the risk of virus. And the vaccination was not brought for COVID, but COVID was brought in for the vaccination.
I think that is why Hanima wrote an article, a word of caution to all sick persons. Allopathy. There's an essay in Lesser Writings. A word of allopathy, a word of caution to all sick persons.
So these are things we need to remember, and I will show you one more slide